found in all frontline ambulances. In the left pocket here, you have your defib pads, and in this pocket here, you've got your 12 lead ECG, your test shock box, your cardiac drugs, which is GT and aspirin. You also have spare electrodes and a razor in there. At the start of each shift, you need to make sure that the defib pads and cardiac drugs have not expired. In this pocket here, we have our 3 lead ECG, we have our spare paper roll and the Wi-Fi. To check the paper at the start of each shift, you just unhook this and pull it down so you can see the paper. This has enough paper, so we do not need to change it. In the back here, we've got our blood pressure cuffs, which range from bariatric down to paediatric. You need to make sure that you've got all of these so you can get accurate blood pressures on your patients. There's also a spare set of defib pads, which you also need to check have not expired. Back here we've got the batteries. To test them at the start of each shift, you need to press the buttons here. This one here is running a little bit low, so to unclip it, you just unclip it there and change it. So, up the top here you have your pulse oximeter and your end-tidal CO2 tubing. We don't use this, but paramedics do, but to be able to pop it in, you just pop it in there. It's like that. Alright, now, at the start of each shift, you need to conduct a user test to make sure that the defib is working properly. So what you need to do is put it into advisory mode, you press lead and then options, and you scroll down to user test, and that will test that.
A few moments later.
Comes out timed and dated, and it says that the user test has passed. Next, you want to be checking that the defib is delivering the correct amount of shock. So you want to unattach your defib pads and attach this into the shock box. Now you want to pop it into manual mode, so what you need to do is press energy select, and yes, you want to enter manual mode. We don't need to be charging it to 360, so putting it down to around 50 joules is okay. To charge it, you press charge. Once it's charged, you press this button to deliver the shock. And then it will come up on the screen that the energy has been delivered, so you know that the shock's been given. If at any point you want to disarm, while it is charging, so it's charging, you just press the button down here, the home button. There's also a metronome on these LifePak 15s, however, gold standard high performance CPR runs at 110 compressions per minute, however this defib runs at 100. But however, to find it, if you are asked to, you just press the CPR button and that automatically starts. Also, you want to make sure after the test, you need to reconnect the defib pad on MI2 lower limb leads. To be able to see this on the LifePak, you need to ensure that you're in advisory mode and you go down to lead 2, and then your rhythm will start popping up here along the top as well as your heart rate. If at any point you need to go into AED mode, press analyze, and that's going to take you into the AED mode. But at the moment we want to be in advisory and on lead 2. If at any point you want to have enlarged the QRS complex of this, you can change the size, and then you're able to see the waves a bit clearer. Also, if you want to turn on the sound for a patient's heart rate while you are doing interventions for them, click on this, turn this up as loud as you want and you'll be able to hear it. When you're doing this though, you need to ensure that you are feeling for the patient's radial pulse as well to make sure that the two correlate. Alright, also need to have SpO2 attached. So this measures the amount of oxygen bound to hemoglobin in the capillary beds. Patients who have nail polish on can give a false reading. You also need to be aware that patients who have suspected carbon monoxide poisoning, carbon monoxide has a higher affinity of binding to hemoglobin, so can give you a false high reading. Normal saturation rates are between 95% and 100% in healthy adults, and patients who have chronic respiratory illnesses such as COPD can actually function quite well on a lower O2 saturation reading. To be able to print what's on screen, just press print down here and that will come out like as such. And then to stop, press printing again. To check a patient's blood pressure, you can actually, to save time, go down into normal blood pressure, BP down the bottom, and set an interval. And that's going to save time. And then start that, and then this will start pumping up as like that. And then so every 5 minutes, so I've set a timer for 5 minutes, that blood pressure will take. Blood pressure so you get your two numbers, your systolic blood pressure and your diastolic blood pressure. Your systolic blood pressure is when the heart is contracting, that's the pressure against the vessels and the baroreceptors detect that. And your diastolic is the pressure against the vessels when your heart is relaxing. Alright, so this is an oxygen cylinder. You'll find these in the ambulance. This is a little portable one that you can take out with you. You can identify it by the white cylinder, and it is also labelled oxygen in it. You need to be able to tell the difference between oxygen and medical air, because medical air contains different gases and is used for different purposes. This is the regulator that goes on the oxygen bottle. There is two prongs there and the Bodak seal. So you put it on, you line it up, and screw it on just like this. Alright, to turn it on, you just twist the nozzle up top. This needle here should come up, but this oxygen bottle is empty. Before going out, you want to make sure you have at least 2 litres of oxygen in there, or ideally a full oxygen tank. And to turn it on, you turn it on at this side here, so it's on there and on there. If you want to give oxygen, you can give it through many different ways, but if someone's just requiring a little bit of a top up, you can use nasal prongs. You use 2 to 4 litres for nasal prongs, and then once you get there, up there, you can go up. So to turn it on, just turn it up like that on the side. Okay, so today we'll be testing the suction unit. To test the suction unit, you need to make sure that your finger is over the test button, turn it on full, and keep the hose. It'll take 5 to 10 seconds. We're testing the suction unit just to ensure that it's working properly and it's actually going to do what we need it to do. Turn it off and let it go. So that means that our suction unit is working properly. Batteries are on the side here, and this is water to clean the unit once it has been used, and this is the canister that the secretions will go into. Indications for using a suction unit is when there is foreign bodies in a patient's airway, or they're unable to clear secretions for themselves. Today we'll be using a rigid yanker, but we would also use a soft tip catheter, say when we're in transit or in young children, because there is a potential to cause soft tissue damage. So when using it on a patient, we need to ensure that they're on the side so that gravity can help move those bigger secretions out of the way, and hopefully the patient may potentially be able to clear it. To use, we need to turn the suction unit on. We only put the yanker in the mouth as far as we can see. Once in position, you cover the hole and in circular motions suction on the way out. Use suction no longer than 10 seconds, because when suctioning longer than that, there is a chance of increasing hypoxemia, causing soft tissue damage, and inducing vomiting. Alright, so this is our first response kit. In the top pocket here, this is your vital signs compartment. You've got your blood pressure cuffs, your stethoscope, your pupil torch, your thermometer, and your glucose kit. This pocket here, this is generally paramedic and ICP's drug pocket, so they have all their drug rolls in here. This top pocket here is your miscellaneous one. You've got your emesis bags, your C-spine lanyards, your ethyl chloride spray, and your N95 masks. And this one, this is your glycemic one, so it'll be Hyperfit, IV glucose, and your glucagon. This is your hemorrhage pocket, and here you've got your cat tourniquet, dressing, slings, steri strips, and bandages. This top pocket here, this is our drugs pocket, so you've got your ibuprofen, your tramadol, Panadol, and loratadine in here. This is our airway management one, so this will have our OPAs, MPAs, your manual forceps, and your laryngoscope, and a biohazards disposal bag. And here, this is our nebulized medication, so you've got your salbutamol, ipratropium, and adrenaline. You've got adult and children's nebulizer masks, as well as spare O2 tubing. In the main compartment here, you've got your towel, you have your sharps container, slippery slam, your C-spine collar, cardboard splints, you have your IV drug roll, so that'll be used in cannulation, pediatric and adult BVM packs. In the adult one you will be having your PEEP as well in there, as well as your LMA packs, which is for more of an advanced airway. Okay, for airway management there are some non-invasive head manoeuvres that we can do to open a person's airway. We've got the head tilt chin lift, got the jaw thrust, as well as we can put them into the recovery position. This helps gravity to allow to remove secretions from the airway and help prevent aspiration. They're particularly in patients who are choking. We can use a sniffer's position, so you just pop a towel underneath the neck as such, and that helps to bring the head up like that. So there's a couple of airway adjuncts that we can use to help maintain a patient's airway. The first is the oropharyngeal airway. You measure this from the corner of the mouth to the angle of the mandible. Indications for this is a GCS lower than 8, motor score less than 6, and incomprehensible sounds to pain. To insert it, you insert it upside down, twist it 180 degrees, and it goes in like that. Complications can be that it induces vomiting, it's too big or too small, there's soft tissue damage, and locked jaw. Contraindications is that if the gag reflex is still intact, right? And if an OPA is inappropriate, then we can move to an MPA. So indications for this is a GCS less than 8, incomprehensible sounds to pain, and an OPA is inappropriate. You measure it from the knees to the corner to the angle of the mandible. To insert it, you need to make sure that you've got some lubricant on there, and you insert it into the patient's largest nostril, and you go down like that. Complications with this is nosebleeds and polyps, and contraindications if the patient has a suspected or confirmed head injury, namely a base of skull fracture. Alright, so this is our bag valve mask. We use this in patients who are bradypneic, so less than 12 breaths per minute. Normal respiration rate is 12 to 20, and they're poorly perfused. The components are, here is the mask seal, this is the filter, and this is the PEEP. So this stands for positive end expiratory pressure. PEEP helps to splint open the alveoli and allow a greater surface area for gas exchange. We wouldn't use this in patients who are in cardiac arrest or have a pneumothorax. It's good for patients who have pulmonary edema and decreased surface area. This is the BVM chamber, and this is the reservoir bag. Down here we have our O2 tubing port, and this is our O2 tubing. To check that it's working properly, we want to turn on the oxygen and see that our reservoir bag is filling up nicely, as you can see that it is here, and there is no leaks. When using a BVM, you want to be using 10 to 15 litres of oxygen per minute. Alright, next. So when using the BVM, we need to ensure that we're getting a good seal around the mouth, so we're using our CE grip. And when ventilating, we're using 3 fingers for no more than a third of the bag and for no longer than 3 seconds. Quite often you can get a bad seal, so you'll be needing to use 2 hands and use your CE grip and having your offsider to help ventilate. Complications with using the BVM can be hyperinflation of the lungs, gastric inflation, and also barotrauma. Difficulties when using the BVM, so we use moan, so that can be the mask seal, so people who have beards and often have a bad seal, obesity, age, neck stiffness, and no teeth, as well as snoring.